any allergies?
Nope.
Okay. On a scale of 1 to 10, 10 being the worst pain, what is your pain level today?
0.
0. Okay. When's the date of your last bowel movement?
It was today.
Okay. Have you had any changes in your bowel patterns?
Mm-hmm.
How about in your urination patterns?
Nope.
Okay. So what we're going to do today is I'm going to get your vital signs, and then we're going to do a head to toe assessment, okay?
Okay.
It's 130/74.
Okay.
Okay. Can you tell me where you are?
At your house?
Okay. Can you tell me what day of the week it is?
Wednesday.
Okay. Can you tell me who the president is?
Donald Trump.
Okay. Patient is alert and oriented, ×4. Okay, I'm just going to take your pulse, okay?
Okay.
Okay. Your pulse rate was exactly 80 and your respirations were 22.
Okay.
All right. Now the first thing we're going to do is I'm just going to take a look at your head and your scalp, okay?
Okay.
And we'll just move down the body from there. This is hand hygiene. Okay. All right, her scalp is white. Her hair looks evenly distributed. I'm not seeing or feeling any masses or any lesions or any abnormalities. Okay. I'm going to go ahead and look at your ears, all right?
Okay.
So the external ear, I don't see any masses, lesions, or abnormalities. They are a little cold to the touch and pink. The color is normal for her ethnicity. Okay, and here in a second I'll have you stand up and we'll do a little test, okay?
Okay.
Okay. I'm going to go ahead and palpate your frontal sinuses. Maxillary. Do you have any pain or tenderness in those?
No.
Okay. Let me get your temporal pulses. Okay, they're palpable at grade 2. Okay, now I'm going to look at your eyes. The eyelashes and the eyebrows are evenly distributed. Okay, I'm going to have you look straight at this pen.
Okay.
Okay, a little light in your eyes, okay?
Okay.
Okay, so the pupils are equal, round, reactive to light, and I would say that they are grade 5 at 5 millimeters. Okay. The conjunctiva are pink and moist, and the sclera are white. Okay. The pupils, their size is symmetrical Let's see, your nose is symmetrical. I'm gonna look inside your nose, okay? Okay, the nasal mucosa is pink and moist. The septum doesn't look deviated. The nares look even. Okay, I'm gonna have you look straight at this pen. Just follow it, okay?
Okay.
Okay, cranial nerves 3, 4, and 6 are great. Okay, all right. The lips are pink and they look moist. Okay, open up for me. Okay, I see 32 teeth with no caries. The tongue is pink, rigid, and moist. Okay, can you stick out your tongue for me? Okay, the tonsils are grade 3. The buccal mucosa are pink and moist. They look good. Okay. Okay. Can you smile for me? Okay. Can you frown? Puff out your cheeks and swallow. Okay, so cranial nerves 7, 9, and 10 are intact. I'm going to have you move your neck to the side, other side, up, down, left, right. Okay, I don't see any pulsations or jugular vein distension. It looks like she has good range of motion in her neck. I'm just going to palpate your carotid, okay?
Okay.
All right, it's palpable grade 2. Let me feel your trachea. It is midline. I'm going to press here. You tell me if you have any tenderness anywhere, okay?
Okay.
Any
No.
tenderness?
No.
Okay. Arms straight out. Can you go like this for me? All right. Fine motor movements are intact. Okay. Can you roll your wrist for me?
Mhm.
Okay. Do your elbow like a hinge. And go like this. Okay, her joints all feel good. She has full range of motion in this arm. And I would assess that bilaterally. Squeeze me, push me, pull me. All right. The grade of her muscle strength is 5 for both her wrist and hand and her arm, and I would assess that bilaterally. Let me go ahead and palpate your radial pulses. They're palpable at 2. And these are palpable at 2. Okay. As far as her skin assessment goes, it is warm, it is dry, it is an appropriate skin color for her ethnicity. I don't see any masses, lesions, or anything that's abnormal. Her capillary refill is less than 3 seconds, which is good. Okay, would you mind to stand up for me?
Of course.
We're just going to do a couple tests, okay?
Okay.
Okay. I would like you to plug one nose, sniff. Plug the other. Sniff, okay? Can you close your eyes?
Okay.
Plug a nostril.
Okay.
Okay. And then just tell me what you smell.
Alcohol.
Alcohol, that's great. That means that cranial nerve 1 is intact, and I would assess that bilaterally. Would you mind to turn around for me?
Of course.
Okay, I'm going to whisper a word to you. Close one ear.
Okay.
Okay? I'm going to whisper a word and you just repeat it loudly.
Okay.
Okay?
Cookies.
Cookies, that's great. Okay? That means that cranial nerve 8 is intact. Okay? While I have her turn this way, I'll go ahead and do the 9 points on her back. First, I'm going to have you take a big, deep breath. I'm going to find her 10th vertebrae. 3, 4, 5, 6, 7. Okay, take a big, deep breath for me. All right, that breath was very symmetrical. Let me count out these 9 places and I'll have you turn around, okay?
Okay.
So 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 7, 7, 8, 8, and 9, and 9. Okay, that's great. Would you mind to turn around for me? Okay. All right, I'm going to show the 5 spots on your chest.
Okay.
Okay, there's 1, 1, 2, 2, 3, 3, 4, 4, 5, and 5. Now you have 5 different places on your chest that I'm going to show them where I can listen to some heart sounds, okay?
Okay.
Okay. So find that clavicle. So at the second intercostal space, at the right sternal border, let me find it. Okay. This is your aortic valve. Second intercostal space, the left sternal border is your pulmonic. Third intercostal space, still at that left sternal border, is your Erb's point. And I do hear an S3 sound there. And then down to the fourth intercostal space, still at that left sternal border, is your tricuspid valve. Okay? Now, I'm going to have to go under your breast a little bit to your fifth intercostal space. It's going to be about right there. Let me get on the mid-clavicular line. Okay? Let me go under here just a little bit. Okay, I'm going to listen for 1 minute. Okay, I counted 87 beats per minute is normal systolic rhythm, okay? Okay, and would you mind to lay down for me? Okay. Okay, so her abdomen, I'm putting your hands on like that. Her abdomen is flat. I do see a slight pulsation. I'm going to listen to her 4 quadrants starting with the right lower. So in order to find that, I'm going to go diagonally from the umbilicus. I'll listen for 5 minutes in each quadrant. So diagonally again, this would be the right upper quadrant that I'm listening to for 5 minutes. From the umbilicus up diagonally, it's your left upper quadrant. Listen for 5 minutes. From the umbilicus diagonally down is going to be your left lower quadrant, and I will listen to that for 5 minutes. Okay, I'm just going to look at your legs, okay? I'm going to do your pulses first.
Okay.
Right here, got to make sure they see. This is your posterior tibial pulse.
Okay.
I'm going to feel that real quick if I can find it. Okay, it's palpable at 2. This is your dorsalis pedis. I would say that that's barely palpable at 1 right now. Okay, and I would assess that bilaterally. As far as her feet go, they look good. The toenails look fine. They look normal for her ethnicity. The bottoms of her feet look good. Okay, I'm just going to have you, we're going to do range of motion, so I'm going to have you come out and in, okay? I'm going to feel your joints here. Okay, out, in.
Okay.
Okay. And I want you to pull your knee up to your chest, okay?
Okay.
Okay. Alright. And then roll your ankle around for me.
Okay.
Alright. And I would assess all this bilaterally. Her ankle had some crepitus, but she has full range of motion in it. Her knee did not have any crepitus, and she had full range of motion. The hip, the same thing, full range of motion. Okay, can you pull up? Push down. Okay. Push up on me. Hold me down. Okay, and I would give her a grade of 5 for muscle strength for both her feet and her foot and ankle and her leg, and I would assess that bilaterally. Okay, let's have you sit up.
Okay.
All right. Thank you.